When to neuter a Labrador Retriever. To be a Labrador Retriever owner, you must prioritize your dog's needs before your own. When it comes to satisfying the obligation of caring for the pup's well-being, Labradors necessitate significant long-term time commitments. Feeding your lab at the appropriate time, ensuring it gets plenty of exercises, and scheduling a neuter appointment at the appropriate age are just a few of your obligations. Neutering is a medical treatment that involves physically removing the testicles from male dogs, hence removing their ability to reproduce. In this day and age, attitudes toward neutering vary greatly from country to country. Following are a few examples of whether neutering is meant to be a beneficial thing for all dogs or whether it would cause more harm than good. When is the best time to neuter your Labrador Retriever? Though neutering Labradors has proven to be quite advantageous over the years, you must have the process done at a suitable age since this can represent a major threat to your Labrador's health. Many vets believe that neutering your Labrador puppy while it is only 6 months old is preferable. However, one study found that neutering a Labrador at this age increases the probability of joint issues and, in certain cases, may even cause cancer. According to the American Kennel Club's Canine Health Foundation, it's probably ideal if your Labrador Retriever is neutered after puberty, which occurs between the ages of 9 and 15 months. The advantages of neutering your Labrador Retriever. There are numerous health benefits of neutering your Labrador Retriever. Some examples might be: birth control. Many dog owners believe that it is their responsibility to neuter their Labrador Retrievers at an appropriate age in order to prevent the birth of puppies. Though there are various different procedures to ensure that labs do not breed throughout their lives, neutering is widely accepted as a popular, permanent way to stop reproduction. Neutering your lab can help to reduce overcrowding and put an end to dangerous breeding practices. Reduces health risks. Studies have indicated that neutering a Labrador can help it live a longer life. Male labs have a life expectancy of 13.8%, whereas female labs have a life expectancy of 26.3%. A gonadectomy is a surgical treatment that not only neuters your Labrador but also lengthens his or her life. It also lowers the chance of pyometra, a potentially fatal uterine infection that is common in labs. Neutering can also help to decrease testicular cancer in men and cervical cancer in women. For behavioral reasons, many Labrador Retriever owners believe that neutering is the best way to enhance their dog's temperament. Because male Labrador Retrievers begin to exhibit undesired behaviors such as mounting, roaming, and hostility towards other dogs or family members as they reach adulthood, neutering is regarded as the best available strategy for reducing these erratic tendencies. Reduces sexual behavior. Because testosterone levels drop after neutering, the Labrador's propensity to be attracted to female dogs is moderately reduced, which eliminates roaming, masturbating, and mounting. Reduces aggressive behavior. Castration has been shown to be an effective strategy in removing certain forms of aggression caused by the presence of testosterone. Furthermore, neutering your Labrador eliminates the possibility of aggressive hereditary features being passed along. The dangers of neutering your Labrador Retriever. The effectiveness of retrospective investigations has led specialists to feel that there is no conclusive evidence that neutering your male dogs will assist in preventing all health issues. The following are some of the reasons why neutering your Labrador may be harmful to his or her health. Obesity risk. When your Labrador retriever is neutered, it gradually loses its metabolism and, as a result, becomes chubby. According to research, neutered animals require no more than 25% of their body weight in calories to sustain a balanced diet. As a result, if a pet owner wishes to have his pet neutered, he must first change his dog's diet. Growth issues. Veterinarians always urge dog owners to neuter their Labrador retrievers once they reach adolescence. The reason for this is that hormones play a critical role in your Labrador's growth and development. Early neutering of your Labrador can cause the closure of the growth plate to be delayed, resulting in a growth spurt in a Labrador at an early age. Later in life, the dog is more likely to develop joint problems. Hypothyroidism risk due to hormonal imbalance. Hypothyroidism is a medical disorder induced by a hormonal imbalance following castration. This eventually disrupts your Labrador's metabolism, body temperature, and heartbeat rates. Neutering is a surgical procedure performed by veterinarians to assist in the desexing of a Labrador. Before performing this surgery on Labradors, vets primarily utilize general anesthetic to render them asleep. As a result, doctors have determined that at least 20% of castration surgeries performed to have at least one problem as a result of the use of general anesthesia, which affects your Labrador in the form of an infection or an abscess. Fortunately, the majority of problems caused by general anesthesia are minor, with less than 5% being significant. Also, while the death rate from general anesthesia in Labradors is less than 1%, this does not necessarily imply that it is fully safe. Various techniques of neutering. Neutering is one of the oldest consistently practiced surgeries in the modern era. There was a time when neutering was simply a medical treatment to assist in the desexing of a dog. However, there are currently various neutering treatments available to make a lab infertile. They are as follows. Male Labrador retrievers are customarily castrated surgically, with vets making a small incision in their scrotum to physically remove male testicles. Surgical castration is an effective method of birth control since dogs recover rapidly and become infertile in a few months. However, it is a permanent surgery that cannot be reversed. Chemical castration. A novel and effective method of neutering your Labrador is chemical castration. This treatment involves injecting a substance called Neuterin into your dog's testicles. Though this chemical may result in infertility in your Labrador, it is not as successful as surgical castration because it may not result in complete infertility. For labs, this treatment is widely regarded as reversible. As a result, some dog owners explore chemical castration as a test run before committing to surgical castration. The consequences of neutering a dog. Aside from rendering your Labrador sterile, neutering has a number of other consequences. Some examples are: the physical look of a neutered male Labrador will be devoid of testicles. Due to the absence of the dog's testicles, a male can be mistaken for a female. As a result, lab owners who prefer to see their dogs with all of their parts intact do not want to have their canines neutered. To address this, one might choose fake testicle implants, also known as nautical, for their lab to maintain them appearing the same. Behavioral changes. Changes in the behavior of a neutered Labrador are unpredictable. Certain habits, however, tend to decline when testosterone levels fall. Constant piddling, i.e., cocking its leg every 5 minutes, loud behavior, and roaming are a few examples of decreases.